Today we will discuss about hepatic encephalopathy. As we know, it is one of the complications of liver cirrhosis. So when the liver is cirrhosed, there will be portosystemic shunts, and as we know, the liver is not functioning, so the metabolism of ammonia will decrease, and that will lead to neuropsychiatric dysfunction. Let's suppose here we have a liver, and here is our portal system, and here is our systemic circulation. And when the liver is damaged or not functioning, so what will happen? The portal circulation will meet the systemic circulation directly, as the liver is not detoxifying any agents, so that all the agents will be in the systemic circulation. Okay, so the neuropsychiatric dysfunction in the beginning will be reversible, ranging from disorientation. Disorientation is the condition when the person doesn't know what time of the day is it, where the person itself is, like school, home, hospital or office, and who is the person actually. Another condition is ataraxia, that is mild in the beginning to difficult arousal, or coma, that is severe. Now we will talk about the triggers of hepatic encephalopathy. The first is increased production and absorption of ammonia, that can be due to dietary protein. When there is increased amount of proteins in our diet, there will increase absorption of ammonia from the GI tract, and as there is liver is not following or obeying his orders, so that will lead to increased amount of ammonia in the blood, that will eventually moves to the brain. Okay, another condition is GI bleed, and the third one is constipation. When there is constipation, the GI tract is moving very slow, so the food inside the GI tract will get more time to be absorbed, so that is why there will increase ammonia production in the GI tract. And another condition is infection, that will be the infection of GI tract, because the ammonia will produce inside the GI tract by the bacteria. Yes. The second condition is decreased ammonia removal from the body due to renal failure, diuretics, bypassed hepatic blood flow, or post-transcellular intrahepatic portosystemic shunts. Yes, when the liver is cirrhosed or any condition, we have to bypass the liver. So we internally put the shunts inside the portal vein and inferior vena cava, so that the liver can be bypassed and bypassed hepatic blood flow post-transjugular intrahepatic portosystemic shunts. That means artificially there is a communication between inflow portal vein and outflow hepatic vein. So when there is no connection of the liver, the portal vein is directly communicating with the outgoing hepatic vein, so that is why there will be decreased ammonia removal. Okay, so now we will talk about the treatment of this condition. First of all, we will use lactulose that increase ammonium ion generation. Lactulose produces an osmotic laxative effect, reduces the pH of colonic content, thereby limiting colonic ammonia absorption, and promotes incorporation of nitrogen into bacteria. And other drugs used are rifaximin or neomycin. These drugs will decrease ammonia producing gut bacteria. The altered mental status in this condition is due to impaired neurotransmitter formation, astrocyte dysfunction, and neuroinflammation or edema. Okay, for understanding purpose, let's suppose here we have a portal vein, Here is our liver, and here is our systemic circulation. When the liver is cirrhosed or not functioning, so the blood will move from the portal vein to the systemic circulation, and there is a blood-brain barrier present before the blood enters to the brain. So this blood-brain barrier is made up of the astrocytes. Yes, so there are some products that can cross this blood-brain barrier when they are high in amount. So when these products, and ammonia is one of them, cross the blood-brain barrier, it eventually enters into the brain and disrupt the function of brain. So when there is neuropsychiatric dysfunction occurs, so that means the blood-brain barrier is crossed and the ammonia is entered. So it is a very simple diagram just for the understanding purpose. I hope you like it.